Hello, this is Dr. Sanjay Khadgi, Senior Consultant Urologist and MD at Khadgi Institute of Endourology at Kathmandu, Nepal. Well, today I'm going to demonstrate you mini HoLEP by using 22 French outer sheet for HoLEP. Well, this is a case of 62 years male patient who came to me with the difficulty voiding, incomplete voiding, and nocturia and all. And during investigation, found to have 24-gram prostate and residual volume was 160 ml, and his urine culture was negative for the growth, and PSA was within normal, and uroflow was, maximum flow was 8 ml per second. So I decided to perform HoLEP on this case after doing cystoscopy, where I found he has all three lobes of prostate are minimally enlarged and obstructed. So I was planning to do HoLEP on this case because the general consensus of HoLEP is it's better to do if size is more than 50 or 60 gram. But if we have good expertise, even in small prostate also we can perform it nicely, and we can separate the plane very clearly. So here is the case to demonstrate you mini HoLEP. As you can see here, it's a severely trabeculated bladder. As you can see here, it's a long-standing prostatic obstructive features. With these features, patient came to my clinic for the further management. Then I had given him a bipolar or HoLEP, and we decided to do HoLEP. So this is an unedited video, and sharing you how we perform mini HoLEP in small prostate, and which hardly took us for 16 minutes in the entire procedure. And as you can see here, I can start at the side of Beru and going up for marking at the white line, as you can see here. And this can protect post-op urinary incontinence. So once we are well trained with the HoLEP, so no worries about incontinence, and we have to follow one system, how to start, which lobe to start, whether we should go with the 3-lobe technique or 2-lobe technique. But I prefer to do en-bloc technique. As you can see here, I did not find much difficulty, and capsular plane is very easy. As I mentioned you that general consensus is HoLEP is for more than 50 gram. But as you can see here, with a small nick, you can easily open this capsular plane. This is the posterior plane. You can nicely see, and you can advance the scope in between the group so that it separates very easily. And side by side, you can do the hemostasis, as you can see here, and you can advance, and somewhat you can do mechanical push that makes the technique much faster. And we just have to follow one system. How we start, whether it's from the right lobe or left lobe, or left lobe to right lobe, and this is the case. I was starting from the left lobe, as you can see here. Once I see the plane as adenoma and the capsular plane, I just quickly advance my scope and advance the laser, and that makes the time saving. And we are already, being a small prostate, we already opened the bladder neck over there. As you can see here, wherever there is an attachment. The key I want to highlight on this is need to follow the capsular plane all the time. If we do not get this plane from one side, we can come from another side. And here I was doing some mechanical push, as you can see here, and side by side using the laser. And this is not a high watt laser. I'm using just a 65 watt laser, and my laser setting was 2 joule and 30 hertz, I think, which is more than enough for the HoLEP procedure. And see, within the few minutes we can detach from the left side, and whenever I can see a group between the adenoma and the capsular plane, I just make it fast, which makes our easy procedure. And this is an unedited video, as you can see here. As I mentioned earlier, that my message is very clear, that even for the smaller prostate size, HoLEP is a wonderful technique. Just we have to follow our technique. It should be very precise. And if we are perforating, if we are over the adenoma, enucleation may be difficult. We have to rectify immediately, whether we have to go under it or we have to cut the prostate. And the most difficult while doing prostate enucleation is at the even 11 o'clock and 2 o'clock. See, if you can see here, this is at the 11 o'clock. I couldn't see the group, advance my scope close to the adenoma, and this is most of the time. That is the key while doing HoLEP. Your scope should be constantly close to the adenoma and the plane, capsular plane. So when we are at the capsular plane, we can easily separate this adenoma and we can peel it very easily. But we have to confirm by ourselves that if we are dissecting at the prostatic tissue, which means separation is difficult, and we have to find the correct plane immediately. Otherwise, there will be a chance of high residual tissue, or there may be a chance of undermining of the with the prostate capsule. And this is at the 11. You see, we are just close at the bladder neck and advancing the scope, and just follow the plane. That is the key while doing mini PCNL. I'm almost close to the 6 o'clock. As you can see here, I was trying to separate from 12 o'clock, but there was somewhat difficult because of the small gland, and whenever we find difficulty from one side, anytime we can change and come from another side. That is the beauty in laser enucleation of prostate. And you can see almost we have separated within 8 minutes, I guess 8 to 9 minutes, and simultaneously we can cut, we can do the hemostasis, as you can see here. It's not that difficult, but we have to be trained and see it's en bloc, and whenever there is a band or tissue, as you can see here, we can advance our scope. And at this position, if you notice, my laser fiber is coming from 12 o'clock. It can be kept at 6 o'clock also. It's no hard and fast at all. And you can see it's almost separated. And the key is, this is the band holding sphincteric area, holding the adenoma. This is very, very important step, and we have to advance gradually, not to take much sphincteric tissue, and we can easily differentiate this with the prostatic tissue. Yellowish color, as you can see here, is all about the prostate tissue. So whenever we feel doubt, we can pull back our scope somewhat back, and we can inspect nicely rather than cutting too much tissue or incision at the sphincteric level. See, and you can see here. So it's a very nice procedure. I really love to do. And once again, even those people who want to start laser enucleation, they can even start with the small gland. It's no problem at all. It's no problem at all. It's not that difficulty while doing this enucleation. Just we need to see how some masters are doing and follow some certain rules, how you do your HoLEP, and important is to save the sphincteric area. That is the key in HoLEP. So there may be a chance of some bleeding and all, but nothing much to worry. This is at the 6 o'clock we are dissecting. Just try to lift the edematous tissue. As you can see here, a small portion of perforation also you can note while doing HoLEP, and left ureteric orifice saved. It's very close by. This small undermining, and you can see some tissue, as you can see here, and we don't have to worry till you see this yellowish glandular tissue while doing HoLEP, which means you are completely at the right plane. So we have to master by ourselves. I have to see how other experts are doing and modify according to your choice, and my message once again is this HoLEP can be performed even in a small gland, and it does not take much time. And see, as you can see, a complete clearance within 12 minutes. Resection is done. Now proceeding with the hemostasis. As you can see here, we need to it should be very clear. We should spend some few minutes for the good hemostasis, as if we cannot achieve good hemostasis, morcellation cannot be proceed. And see, this is at the 12 o'clock, almost sphincter, and there is no active blood bleeding noted. And this is the beauty. I really love this, and I don't have that much big high watt laser. This is just a 65 watt laser, as mentioned. Basically we are using for hemostatic, and most of the time we are doing some mechanical push for the enucleation. So this is the beauty. And I had been doing with the diode laser since 2010, but it was a bit difficult when to separate the adenoma with the capsular plane. But with the HoLEP, I found it very easy, very precise, and it's really time-saving procedure. And what another thing is, as we used to do bipolar also, but with the HoLEP, I found post-operative bleeding is drastically reduced in my practice. When we were doing some bipolar or diode laser enucleation, some people, even for several weeks, months, they still complain of burning urination. So this is almost completion of enucleation, as you can see here, and no bleeding. And see, nice fossa, small gland. If you see, this is, we spent so far 15 minutes 40 seconds. I just checked it in the clock, and I encourage all the juniors who are planning for the laser enucleation. And first, one has to see how different surgeons are doing it differently, and choose the best one. And here, this is an unedited video. We are just changing the morcelloscope. On the same size of 22 French, I can accommodate this morcelloscope. See, this is a completely unedited video, as it's a small gland and we didn't need to spend so much time for the morcellation. It hardly took 2 minutes, I guess, for the small gland. Even for the large gland, juicy gland, it sucks very easily. And these cases I have been doing for last almost 15 years, but with difficulty I have been doing with the diode. But recently I changed to HoLEP, and I am enjoying doing HoLEP. But one thing, we have to be well equipped. If we don't have, we have to have a good machine, we have to have a good instruments, good morcelloscope, and then the smooth procedure will be uneventful, and we can have a good sleep. So this is the end of the procedure. As you can see here, it took us 16 or 17 minutes. The entire procedure, like a minor procedure. See, complete fossa is clear, as you can see here. So thanks to my friends once again for watching this video, and enjoy HoLEP. Thanks.